Welcome to the Community Health Talk. Today we will talk about keeping yourself and your family away from three kinds of cancer. Now, what is cancer? Well, you know that many bricks make up a wall. Similarly, many small cells make up the human body. As you know, walls sometimes develop a small crack. If we don't repair it immediately, it can slowly become a very big crack and destroy the entire wall. Similarly, human bodies can sometimes have a small health problem. If not detected early, this can become cancerous and cause a lot of suffering. So, early detection of symptoms is the best way to stay away from cancer. Three cancers that are common in India can be detected early. These are oral cancer, breast cancer, and cervical cancer. Let us look at cervical cancer. Cervical cancer occurs inside a woman's reproductive system. To understand how it happens, let us first understand what the female reproductive system looks like and how it works. The female reproductive system is located below the navel. This is how the reproductive organs actually look like. And this is how it looks like from the inside. Let us look at the 6 parts. These two egg-like things are the ovaries. They produce eggs during each menstrual cycle. These tubes are called the fallopian tubes. They carry the eggs from the ovary to the uterus. This is the uterus. This is where the baby lives during pregnancy. This is the cervix. It allows menstrual blood to flow out every month and let the sperms enter during intercourse. This area is the vagina. It connects the uterus to the vulva. And finally, this area is the vulva. This is the only part of the female reproductive system that can be seen from outside. Let us look at the 6 parts once again. These are the ovaries. These are the fallopian tubes. This is the uterus. This is the cervix. This is the vagina. And this is the vulva. What is HPV? HPV is a very common virus, just like the cough and cold virus. The HPV virus is found in both men and women. It spreads through sexual intercourse. Usually, just like a flu or a cold, the HPV virus clears up on its own. However, sometimes the infection persists and in a few years can turn precancerous. If left untreated, precancerous cells can turn into cancer. Regular screening detects lesions caused by persistent HPV infections on the cervix. Women must undergo screening once in every 2 years. What happens if you don't go for cancer screening? Well, you won't know if you have persistent HPV. And if you continue to not go, you won't know if it turns into precancer. And if you still don't go, the precancer will not be treated and it may turn into cancer. Once it turns into cancer, you will face pain, suffering, and the expense of treatment. If you do go for regular cancer screening, you will be safe. If you have persistent HPV, your doctors will monitor your health closely. If it becomes precancer, you can have a small outpatient treatment or surgery immediately. After that, if you continue with regular cancer screenings, you will live a healthy life, safe from cervical cancer. Are you at risk of getting cervical cancer? Let's find out. Early marriage is a very big risk factor for cervical cancer. Women who marry before the age of 20 are particularly vulnerable. Having many children too close to one another is another big risk for cervical cancer. Having more than 2 children with less than 3 years between each child will put a woman at higher risk. The HPV virus spreads through sexual intercourse. Having multiple partners, whether at the same time or one after another, increases the risk of cervical cancer. Tobacco in any form can make a person vulnerable to cervical cancer. Zarda, pan, bidi, cigarettes, brushing with tobacco are all dangerous. Some things may indicate the possibility of cervical cancer. Let's see what these are. If there is bleeding during or after sexual intercourse, it could be a symptom of cervical cancer. If there is some bleeding in between menstrual cycles, repeatedly for few cycles, it could also be a symptom of cervical cancer. Finally, if menopause has already happened, but there is still occasional bleeding, it could be a symptom of cervical cancer. If you have had any of these symptoms, please see a doctor immediately. Explain the symptoms and ask for clinical screening. The most important thing to remember, however, is that cervical precancer is asymptomatic. It can grow inside without showing any symptom on the outside. The only way to keep yourself safe and healthy is to go for regular clinical screenings. What is screening? Screening is the process of catching an illness before it spreads. Let us see what the screening for cervical cancer is like. The screening of cervical cancer is done through the VIA-Willi test. The test is short, painless, and happens in a complete privacy as an outpatient procedure. When you go for cervical cancer screening, all you have to do is lie down in a private room. The only people in the room will be doctors and nurses. First, the doctor conducting the screening will wear a pair of new gloves and then approach your vaginal opening with a speculum. This, by the way, is what your body looks like on the inside. This is the vaginal opening, and this is the anus. Now, the doctor will gently slide the speculum inside your vagina and locate your cervix. This is a painless procedure. The speculum will be fixed in place so that it doesn't move. The doctor will then take a cotton stick, dip it in 5% acetic acid solution, and apply it on your cervix. Wait for few minutes, 2 to 3 minutes after application of acetic acid. The doctor will observe the changes on the cervix After that, the doctor will dip another cotton stick in Lugol's iodine solution and apply it on your cervix. The doctor will observe the changes on the cervix after application of Lugol's iodine. The doctor will then clean up your cervix and gently withdraw the speculum. Your VIA-Willi test is done. If your test is positive for the VIA-Willi, don't worry. A positive VIA-Willi does not mean that you have cervical cancer. It only means that you need to have further tests. Your local health worker, doctor, or nurse will help and support you through these tests. Treatment for cervical cancer can be very simple, provided you go for regular screening.